so my name is Dr. Julia Pullin and I'm the founder of the Chiro Health Clinic. Now, I heard that you'd missed the workshop this week, but that's not a problem. So what we decided to do was actually send you a little video which summarised what we covered, what we learned, so basically you didn't feel like you'd missed out. At the beginning of this presentation, we're going to be talking a little bit about low back pain and sciatica as well, but then we're going to come on to more specifically what happens with a slip disc. What we're going to do now is start running through a little bit of the anatomy so that you can understand what's actually happening. So I'm about to go grab my spine. Okay, right then. So what we have is the pelvis down here at the bottom, which is made up of iliac crests over here, sacrum in the middle, coccyx down at the bottom, little wiggly bit at the bottom. We have 24 vertebrae running up through the spine, okay? And then each of them are separated by little joints, which hopefully you can see just there, okay? And those little joints, they only move a little bit, it's not much. But all the movements add up to give you global movement, so you can bend, twist, do all the things that you need to do. If I show you in the neck, then you can see they are very little dinky little joints there. And again, they move only a little bit, but they add up so that you can bend and twist, all right? These bubbles at the back are what you can feel through your skin. And if I turn you around, you can see more the weight-bearing part of your spine. So you've got the vertebral bodies, and then you've got the discs in between, okay? Purpose of your disc, three main purposes of your disc. So the disc is firstly a shock absorber. Secondly, it is a spacer which allows for enough room for this little dinky nerve to come out of this hole here. And then also it allows for the flexibility as well so that your body can bend and move, okay? So obviously the discs have very, very important role. They are phenomenally strong. And the best I can describe it, they are a little bit like a poached egg. So you've got the white on the outside and then you've got the yolk on the inside. So the yolk on the inside allows for its flexibility, but the white on the outside are fibres that are overlapped, and that's where it gets its strength from, and they're like onion skin, so there's multiple layers. So your strength comes from the outside of the disc, okay? All right then, so you have the base of your skull, your brain would sit at the top, your spinal cord runs all the way down the centre, and then your nerves exit out of these holes at the side, and they go to supply every cell, every tissue, every single organ in your body. Nothing happens in your body without messages going from your brain, down your spinal cord, out to whatever they supply. But also, interestingly, there's a feedback mechanism. So what actually happens is messages come back from those cells, tissues and organs into the spinal cord, up to the brain to say what's actually happening. So you've got this constant feedback loop going on all of the time, okay? So that's a little bit of anatomy about the spine. Now, my job as a chiropractor is to make sure that all of this is functioning how it's supposed to. So why do you think that is? So the purpose is to make sure that the nerve supply to all those cells, tissues, organs, whatever they're going to supply, are working exactly how they're supposed to be working, okay? Now the most common cause of nerve interference is actually when these joints aren't moving how they're supposed to. Your disc is a little bit like a poached egg, okay? So let me go. Imagine that is your disc. So it has a yolk, so it has a centre to it, okay? And this is called the nucleus. And the nucleus is where you get a lot of your shock absorption from, the pliability, because it's a little bit like toothpaste consistency on the inside, okay? Then you've got the white on the outside. Now it's the white on the outside that gives it its strength. So, and how it actually does that is it's because it's in multiple layers, okay? So it's a little bit like an onion skin on the outside, like this. and each of those layers are aligned so that the tissue structures will go in one direction and then the next layer will go in the other direction, so that you're forming this mesh one on top of the other, and this is where its strength comes from. So let me just show you a model of it. Here we go. So here's a little model, so you can see that you've got your nucleus here and then you've got the white on the outside, okay? And so that's where its strength comes from. So let's talk specifically about slip discs, okay? So remember what we said about the fact that you've got the nucleus on the middle, so that's like the yolk of your egg, and then you've got the white on the outside, so these are the annular fibres, a little bit like the white of your egg. Well, when people are talking about a slip disc, then nothing has actually slipped. So if you're thinking about the disc as a whole, it hasn't shunted over or moved out of alignment. So let me show you what actually happens. So with, let's say, fatigue, so if an area is overworked, for example, or you say have really poor nutrition and so that you haven't got good building blocks going into your body, then what can happen is the area weakens. So what happens is these outer fibres start to kind of split away a little bit and crack. So they start to show a bit of a weakness first of all right? And then eventually what happens is the nucleus from the inside will start to creep through the layers up until it reaches a point where it will start to finally bulge. And so a slip disc is actually more accurate if you could call it a disc bulge, okay? But when it bulges out enough, what will actually happen is it can compress on the nerve. And depending on the position of this protrusion will determine what symptoms that you get. So if it's out at the side, then it could be influencing a nerve, so you're going to get symptoms down, say, one leg. However, if it's, say, a bulge that's pushing out towards the back, then you could get other symptoms, even symptoms on both sides, okay? So depending on the location will determine what symptoms you actually get. So just to be clear, a slip disc is also known as a disc herniation or a disc protrusion. All of these mean exactly the same thing, it's just different words that people use depending on what language they've been taught on their course, but they all mean exactly the same thing. And nothing has actually slipped. That's what I need to make sure that you're clear on. Nothing has slipped. What's happened is the yolk from the middle of the egg has started to creep through the fibres, the outer fibres of your disc, and then eventually it bulges out and pushes on the nerve. So who gets a slip disc? Well, realistically, 75% of the population have got a slip disc. So it's quite common. As to whether you develop symptoms or not is another thing entirely. Now, the thing that's unique about slip discs is people think that disc problems occur as you age. Now, degeneration of your disc does tend to occur as you age. However, a slipped disc or a disc herniation, disc protrusion tends to occur mainly in young males between the ages of 20 to 35. The oldest reported case of somebody with a slip disc was a man that was 67 years old. But typically it's more of a younger generation's problem. How can you tell if you've got a slip disc or you've had a slip disc? Well, the first thing you could do is possibly have an x-ray taken. Oops, no. An x-ray is not going to tell you if you've got a slip disc or not. When you're looking at an x-ray, you're looking at more the bony structures, not the disc. You cannot see the disc properly on an x-ray. There are certain tests that you can do in order to ascertain or potentially check if somebody has a slip disc. One of them is a straight leg raise, so you're lying on your back and the leg gets raised up. And if you have shooting pain down your leg, then that could possibly be a sign. But actually, again, there is no guarantee with that test that you actually have a slip disc, so it might not be that. So the only truly reliable way of finding out whether you've got a slip disc is to go and have an MRI scan. But like I say, the reality of it is 75% of the population do have a slip disc anyway, so whether that really is the cause of your problems or not is another thing entirely. How does chiropractic or osteopathy help with a slip disc? Well, the first thing that it does, it helps reduce inflammation. So obviously that goes a long way to reducing the symptoms that you experience. The second thing that happens is it takes the strain off the damaged disc, so that then without less strain going through it, it's less likely to be painful again. And then the third thing that it does, it influences what are called, well, they're special nerve endings that are called proprioceptors and nociceptors. And when we're talking about the nociception side of things, basically what that means is it reduces the amount of pain that you experience as a result of it. So chiropractic and osteopathy, what they do is influence those nociceptors so that you're less likely to feel the pain from the area as well, okay? Now, the one thing that you do need to know is with chiropractic or osteopathy, the size of the disc bulge, the disc herniation or prolapse, whatever you want to call it, does not actually decrease. Clinical trials and studies have actually shown, they've done MRI scans before having an adjustment and afterwards, and even though the person felt loads better and had a reduction in their symptoms, basically the disc bulge did not decrease in size. Which then points to me that it's not the disc bulge that's the important thing. It's the entire sort of situation that's going on, the amount of strain through the disc, the amount of inflammation, the amount of sensitization of the pain fibers that really makes the difference as to whether you are in a lot of pain and uncomfortable or whether you're not. So would you agree with me that everybody should get their spine, their nervous system, their joints checked in order to make sure that they're moving to the best of their ability? I know I'm biased. I mean, you know, I've been doing this job for almost 25 years. I get to see the results day in, day out. I get to see the changes that people go through and the transformations every single day. But the reality of it is, if your joints are moving better, you will experience less pain and you will generally be more happier. And in my words, you will have more mojo. Would you agree with me that everybody should have their spine and nervous system checked at least once in their lifetime? For me, it just makes perfect sense. So if you do want to get your spine and nervous system checked, then all you've got to do is pick up the phone, give us a call, or you can click on the button below.